This educational video will provide an overview and navigation of eMD. Once the icon is launched, you will be prompted to put your personal username and password into this login screen. Once you have logged in, your default screen is your home screen.
Here you will see that you have chart tabs that include patient information and various ways to document. You have icons with their own functionality, toolbars, and other applications within your eMD homepage. We will explore each of these through the rest of this video. When you first log into eMD, your default tab is your patient list tab. This is going to display your patient list or your unit census. In order to make your chart active, you'll need to physically click on a patient, and you'll see that your icons become available to you. In this tab, you will create patient lists and columns for individual preference.
We will now go over the Gateway toolbar within eMD. The top right-hand side of your screen, you have a series of icons. The first one is your Help icon, which will allow you to search for any help topics within eMD. The next one is your Shutdown icon, which will complete your session within eMD and protect HIPAA. The next one over is your Suspend. This will minimize your session and allow you to log back in and pick up where you left off within your eMD session. The last one is your Recently Viewed Patients, which will allow you to see the last 5 patients you accessed within a 48-hour period.
We will now navigate through the main toolbar. Your main toolbar is located at the top of your eMD screen and contains a series of icons with their own functionality. You can customize this based on your preferences. We have a Find Patient icon that allows you to look up a patient through their birth date, their last name, or their MR number. It defaults to the MR number, which is the easiest way to find a patient. We then have our Allergies Summary, which is also referred to as an itchy man. We have an Enter Document icon, which allows you to enter structured notes. Worklist Manager is our EMR, or medication documentation. More header info will allow you to look up more patient information. Change location, we can transfer patients to different beds.
The Print Report icon allows us to print certain reports from eMD. Our Health Manager icon keeps a record of any immunizations or vaccines that were either manually entered or administered in the hospital. Outpatient Medication Review is our MedRec for nursing. We have Signature Manager, which allows us to mark off any tasks that were assigned to us, such as medication co-signatures or document, such as blood. Our SIS icon allows us to start our pre-op record. Document scanning, we can find certain documents such as advanced directives here. Claims on Demand is our education tool. This will link you out to the login screen. Mosby Skills is another tool for nursing to use. Medex or Optio, this is our paper chart. And the External Web Applications is going to link you out to various other applications within one click. You will customize your toolbar using the preferences at the top of your screen and then choosing the toolbar selection and work through the menu available.
We will now talk about your patient header. The patient header runs across many screens in eMD and contains useful information. You will have one icon in the patient header, which is your Enter Order icon. Your first and last name of your patient, their current location, their code status, allergies and intolerances will populate. And if you notice as you hover over these areas, different conversation boxes populate with additional information. Your patient's physician, their MR number and visit number. Other information you may see in your patient header is isolation status and also codes for social work. Your patient's age, birth date, and sex also populate.
We will now talk about the chart tabs within eMD. Your Patient List tab is your default tab in eMD. You will notice that you may have a status board button that will allow you to flip back and forth between ED status board or an observation status board. This is going to provide you different access to the patient lists in which you need. Your Patient List tab is going to hold your unit information based on your current list dropdown. You can choose from this list that you've created to find the patient appropriately. You may customize the columns within this tab to populate information that is helpful for you within your patient care. You can be alerted to new orders, check orders, new documents, and new results. These flags will appear once you've turned your flags on. You may also assign yourself to your patient under the nurse column, and your CNA may also assign themselves, as well as other ancillary departments. Your Orders tab is for order management and review. All orders will be found here. You may use your options panel to change your display and filters to help you more efficiently view your orders. Your Results tab will populate any results done on the patient. There are some images that will populate as well as reports. You may change your display view to help you find your results easier. Patient Info tab is going to display the problem list, so any diagnosis or diagnoses, chief complaints, and so forth. You may also view the patient's visit history here. Your Documents tab is going to be the source of all document review. By using the collapse header option, you will note that there are headers with subheaders, making it easier to view documentation from each area. You can then open up these headers to find the documentation in which you need. Your Assist tab is going to hold all of the documentation from surgery. Flowsheet tab is going to hold all flow sheets that are available for your patient. Depending on the area, they will already populate certain flow sheets, but you have the ability to add other flow sheets that will help you document accordingly to your patient. Our Clinical Summary tab is a summary based on your view. So you may change the view and the time frame in which you want to view the information for your patient. This tab pulls information from all documentation from physician, CNA, nursing, and ancillary documentation in the time frame you specified. It's a great source of information for bedside shift report and caring for your patient. The Data Viewer tab is an excellent source of information as well. Your eMDX tab is our platform between inpatient and outpatient care. You may use this as a view-only application and is a great tool to view the last doctor's visit and verify any allergies, encounters, medical conditions, home medications, and so forth. And lastly, we have our ChartMax tab, which is going to allow you to pull an old chart by locating the documents that you want on the left, and they will populate to the right for review.
We will now navigate through your Orders tab. Your Orders tab is not for order entry, but more order review and management. On the left-hand side, you would have an options panel that allows you to filter and choose different options for viewing your orders. You can view just this chart, all available charts. You can change the date. By choosing the arrow option, you will be prompted to a quick pick menu that allows you to further customize your view. You will need to use the red X to get out of any quick pick menu. Moving down to the filters in the options panel allows you to change the status or priority of how you view your orders. Active orders is an option. This will filter out all completed or discharged orders. Departments will allow you to customize different departments on how you view your orders. Using the Custom tab, you can choose the departments that you want to create your own list for. We will now go ahead and navigate through your Results tab. Your Results tab also has an options panel that allows you to filter out how you want to view your results. There are 4 ways to view your results, and they are all user preference. This is your report by order view. The most recent lab or procedure will populate to the top. If there are any reports, such as a chest x-ray, a ultrasound, or whatnot, you will have an icon with a black addition sign that will allow you to view the report, but not the image. You can also print this report. This option of viewing will need you to scroll through your labs. The only image that we do scan into our Results tab is our EKGs. You will locate your EKG and you'll notice you'll have 2 icons. You'll have the square icon with the black addition sign, which will allow you to view your results. The report can be printed. Locating the icon next to it, Takes a few seconds to load, but we'll bring up the EKG. So you can then view the actual EKG of the patient. And again, this is the only image we scan into eMD. You can use the icon in your tab toolbar for display view. Again, we were looking at the report by order. You have a summary view. This gives you a bigger snapshot of time. Your labs will display in the designated boxes. Once you double click on the flag, it will allow you to see your result in a report by order view. You can change the display view to another view. You have a trending view. I'm going to use the reset button so that I can default back to my beginning of the chart. This will show me again a greater time frame of results. I also have another option called a trend and graph. This portion of viewing results will allow me to see the trend at the top of the screen, and then in order to graph it, I just need to tell it what result I want to see. So in this case, my WBCs will be graphed at the bottom of my screen. We will now navigate through the Patient Info tab. The Patient Info tab is separated into a summary view and data entry views. In the summary views, you can take a look at allergies, intolerances, care providers for this patient, their problem list or diagnoses, and any significant events such as falls, hypoglycemic event, or any codes. You can also look at the patient's demographics, address, and visit history. Data entry will allow you to also enter allergies and intolerances here, discharge a patient, enter admission height and weight, and significant events. You can also view advanced directives through this area. Your Documents tab is going to hold most of your structured notes and any nursing documentation once saved. Different types of documentation you will see are HMPs, physician progress notes, your admission paperwork, discharge instructions, and so forth. You can change the display by document name, document status report, whatever your preference is in viewing your documents. You also have an options panel to narrow your search. It's important to know that you have a previous and next arrow on the far right-hand side of your tab toolbar. So if you're not finding the document that you're looking for, be sure to see if those are highlighted. To view a document, you will simply find the one that you are looking for, make sure it's the correct date and time, and you can double-click on it. The document will populate in its own window in this nice view version. It will show you that it was completed by and the time with your patient's information at the top. You can use the red X to get out of this screen. Viewing multiple documents can be done by clicking on one document and dragging your cursor, using the View icon. Once this menu opens, you're going to use the Document Details option. And your documents will be all combined into one so that you can scroll through them for easier reading. You can also use the document selection on the left-hand side to click through each document as necessary. The Flowsheets tab is mainly for nursing documentation. However, CNAs document here, respiratory, and most clinicians. You can change the date for easier viewing, and in the middle of the options panel, as you see here, there's a flowsheet selection. It defaults to the patient's current location, and all flowsheets that will be needed for the patient will be added. You will also see if they come from another area that it will be separated out, and those flowsheets will be underneath them. You can use the Expand Collapse Rows icon to see the documentation criteria easier. We will now look at the Clinical Summary tab. The Clinical Summary tab is a nice snapshot of your patient's care. You can change the time frames. This is best used at bedside shift report. First thing that you want to do is change the view so that it reflects your profession. We have nursing, there's CNA, there's a professional exchange, there's also physician views, and so forth. Make sure you find the one that is appropriate for you. Once you choose that, you can change your default setting by using the icon that says Save Display Format and Save as Default View. That way, every time you log in, it will be saved for you. You can also use the Expand Collapse Rows icon in this tab as well. And basically what it does is it collapses all the tiles, and you can use a double arrow to the left to open and close each tile. The last tab we will talk about is the Data Viewer tab. This is in addition to the Clinical Summary, which is a great useful tool of information for your patient. The Data Viewer allows you to specialize the information that you want to view in a bigger time period. You'll again want to change your profile. This one says Nursing General. Once you change it, it will stay the same every time you log in. You can change your time frame, your dates, and up to a 2-week period. On the bottom left-hand side is what you can specialize in seeing. Anytime you make a change, you're going to choose the Apply Changes. And again, this is going to give you a bigger snapshot of time and allow you to see all the information in one area.
All of the content presented in this video will be further discussed in your computer training class.